I wanted to talk today about assessment. So this is specifically for NMC OSCE. So this is relevant for all fields, whether you're going for children's OSCE, whether you're going for mental health OSCE. Now there will be some slight differences, so please bear this in mind. My focus is adult OSCE because that is where my skills lie. I'm an adult trained nurse. My experience is in adult nursing, and since the changes in the OSCE, although I do have some mental health experience, quite significant mental health experience, I've decided purely to focus on adult OSCE. So this is about assessment. So as you'll know, you will complete an A to E assessment. That is standard and that does not change whether you're working with a patient in an acute setting, whether you're working with a patient who is in for surgery, either planned or emergency, or whether you're working with a patient who's in the community, so in their own home, or maybe even a care home. The AD assessment is not going to change. Holistic assessment is part of this. Your ADE assessment must be done systematically, and you will not necessarily feel if you don't do it in order. That is not needed. However, there must be a systematic approach, and the ADE assessment is designed to make sure that we don't miss anything and that we prioritise and escalate as needed and as relevant. Okay, so when you are coming into any practical OSCE station, you need to check for safety, and this is actually physically checking. Okay, it's not just saying I'm checking for safety and stepping over a hazard. It's moving hazards. It's making sure that you do check, and that is for you and your patient's safety, not for any other reason other than that. And stating your rationale is really important for everything because the examiner can't read your mind. So if you talk through your thought process and you can incorporate that with your patient, it's really helpful and it makes it less robotic. So that's a bit of advice about practical stations in general, and assessment is no different. So I'm coming in, I'm checking the scene for safety for both me and my patient. That's first. And if you forget, say it later. That's fine, okay? In clinical practice, I would check the scene safety as soon as I enter to make sure it's safe for me and my patient. So moving on, I want to wash my hands using the 7 steps, and I'll use sanitizer, and I'm going to verbalise one of my hand washes until the examiner then has seen me do that. Verbalise that hand wash a few times. They will then realise I understand the 7 steps, and I must then wash my hands throughout at appropriate moments, and that's using sanitizer in most of the test centres. So, a hand wash, palms, back the hands, fingers interlaced, fingers interlocked, thumbs and webs, we'll not forget about those, and wrists. So you can do your hand washing in as long as you're following the World Health Organization 7 steps. It doesn't matter what order it's in, and it doesn't matter necessarily how you verbalise it, as long as you can demonstrate understanding. It doesn't need to be perfect, but it needs to be done. So you'll do your hand washing, your 7 steps, at every moment that is appropriate. So for example, you touch your patient, you're touching equipment and you go back to your patient, or you touch the patient's surroundings, you close the curtains, wash your hands, okay? But it's good to practice this. So for assessment, this is no different, it's important, okay? So if you pick something up off the floor, wash your hands, okay? Think about what you would do in clinical practice and always try and relate it back to that. So if I'm going into a patient for assessment, I am only just meeting this person. I'm new to them. I need to introduce myself. I need to tell them my name because that builds trust. And if you were a patient, you would want to know the nurse's name who's looking after you and what that person's job role as well is. So I'm going to find out also my patient's preferred name. So what do they like to be called? Because as we know, everyone has nicknames. They maybe are known by their middle name. Some people like to be called Mrs. or Mr. Or Doctor. So ask the patient, and you'll use that name throughout their whole care plan as well. So that's a good tip for you. So introductions are important, and remember the patient may be maybe distressed and confused as soon as you walk in, so don't expect the patient to be cooperative immediately. It's up to you to deal with that, okay? So don't let that throw you off, but reorientate, reassure, and listen to the patient. Listen to what they're telling you. Because whether you have a mannequin or an actor, now you will have an actor for assessment, you will be taking that patient's vital signs, that actor's vital signs. Whether you have a mannequin or a patient, it's important to treat them like you would in clinical practice. Okay, it's no different. Eye contact, direct your conversation to the patient, not the examiner. If the examiner is talking to you or you're talking to the examiner, then address them, but otherwise you're addressing the patient. So I've introduced myself, I've asked the patient the preferred name, and I want to identify them. So if they're in their own home, you want to make sure that you do what we call a three-way check. So name and date of birth and address. That's their additional safety check to make sure, because you could have a patient who has the same name and date of birth but not the same address. So if they're in hospital, they'll have a hospital band on, so you can check their hospital number, but you cross-check that with your documentation to make sure you have identified that you're working with the right person. Allergies are important too, because we might be using equipment that contains a substance that that person is allergic to. So are you allergic to any food or medicine or latex? None of this conversation needs to be robotic. You're not a robot. You're a human. Be yourself. So when we've identified the patient, you can do this before or after, but you want to gain informed consent. So this is informed consent. This is key. I'm not going to say I'm doing a procedure, is that okay? That's not enough information for that person to give me informed consent. I'm here to do an assessment today. This is an A to E assessment. This is to assess your needs and assess your needs holistically, to find out what needs we need to prioritise for you and how I need to escalate. I'll take a set of vital signs as well during this, and I will complete either a news chart or GCS chart depending on which one it is. Is that okay? Are you happy for me to proceed? You can ask for consent in a lot of different ways, but it must be clear, and you must remember to listen to your patient and respond accordingly to them. Privacy is important for assessment too, because you will be uncovering the patient, and I will say that to the patient. So I've closed the curtains for privacy, although I will only need to uncover your arm